All right, so for PNF patterns, we're gonna do the D1 flexion extension, the lower extremity first. So we're gonna start down like this. We have leg extended, abducted, toes pointing toward the ground, plantar flex. Then we're gonna bring the patient up into flexion and inversion and curling the toes down like this. So kind of like a modified figure 4, but with more hip flexion. And then the patient's gonna push back down into that starting position right here. So I'm going to resist you as you go through that motion. So go ahead. All right, same thing on the way down. Good. We'll do it again. All right, go ahead and same thing on the other way. So you'd repeat this over a period of time just to get the muscles firing again. And for a D2 pattern, we're going to start up flex like this. Got the medial rotation, dorsiflexion, toes extended. And we're gonna ask her to come down across like this, push her toes toward the ground, resist, we're gonna resist on the bottom side, and then coming back up, we switch sides, and she's gonna come back like this, and I'm gonna resist her on the outside of the knee, and also on the base of the foot. So can you do that motion I just showed you? I'm gonna resist you. Good. Good. Same thing on the way back. Awesome. One more time. Same thing on the way back. And just like that's D2, just like D1, you would repeat it over a set of time to strengthen the muscles. So. All right, so for this, we're doing D1 and D2 flexion extension of the upper extremity. So for first, we're gonna do D1. So put the patient just like this, have the fingers curled, arm in an abducted position, slightly flexed, and we're gonna bring her out like this. She's gonna extend her fingers, resist the wrist and finger extension, and on the way back, we're gonna switch sides and then come together and resist that finger flexion. So starting here, good. Switch sides, good. Good. One more time. Same thing going back the other way. Good. And you would do multiple sets of that just to go through the proprioception for the muscles. So now we're gonna do D2. So we're gonna start her down here, kind of like she's drawing a sword, and you're gonna bring her like this. She's gonna let go or extend the fingers, and then coming back, switch, and she's gonna draw the sword again, closing her fingers, and we're gonna resist that. So let me get you to do that motion. Good. Switch real quick. Go back the other way. Good. One more time. Go back the other way. Good. And just like D1, you would also do multiple sets just to get the proprioception of the muscles. Yeah. All right, so for this section, we're gonna be doing the first rib manipulation. So I'm gonna show you how to fix the issue. So first, you gotta palpate the patient's first rib. We're gonna do it bilaterally. So go right by the scalenes and down by the clavicle, in between there. Push down, you should be able to feel it. We're looking to see if one side is hypermobile. We'll go ahead and say that her left side here is hypermobile. So we're gonna go ahead and do the skill. So put my foot up like this, can you relax your arm right there? So what I'm gonna do is go back here, left hand, palpate the first rib. We're saying it's hypermobile for this incident. And what I'm gonna do is laterally flex her head with slight rotation, put her in this position. Then I'm gonna ask her to push against my hand back to the original position. Push a little bit more. Good. And the entire time of doing this, you want to make sure you are pushing down on that hypermobile first rib. And you do this 3 times with the same motion, and you check afterwards bilaterally to see if the issue has been fixed.
Today I'm going to be doing a plyometric exercise program for push-ups, and we're going to do 5 different levels. So the reason to do a plyometric exercise is to increase the intensity of the exercise. So we're going to start with the push-ups, with wall push-ups. So your arms are going to be shoulder width apart. You're going to go in and do a wall push-up. Alright, and then you'll do like 5 sets of those. And then the next exercise is going to be off the table. And then you're going to go down and do a push-up. Okay, And then the next one is on your knees with your legs slightly bent. And then you're going to do a normal push-up for the next session. And the last one, you're going to work on their form. And then the last one is on the box. So you're going to put your feet on the box. And you're going to go down. For this, you're working on trying to improve the form. You're trying to get them to 90 degrees for each push-up, and that's the way that you're going to tell to progress to the next stage. Today, I'm going to be doing posture exercises. So the first one I'm going to ask you to do is chin tucks. So I'm going to ask you to tuck your chin, and you'll do that 10 times. So you can stop now. And then that's to improve posture. If they have a forward head, it will set their head back. And then the next one is scap retraction, so I'm going to ask you to pull back. You can do that whenever you have time, when you're sitting at your desk, just to work on your forward shoulders. And then the next one, I'm going to ask you to get down into the plank position. And this is to help with posture of the whole back of the spine, and it's to strengthen the core. So you're looking to make sure that they have a flat back and that their butt's not up in the air. And that is it. Today I'm going to be talking about pull exercises and why they're important. For a pull exercise, the importance is that the athlete will have natural resistance because of the water, and also it's less stress put on the body. So some examples of some pull exercises for warm-up, you would start with just like the little circular floaty on them, and then they're just gonna walk the length of the pool. And then the next exercise that they will do, they will jog in place, and they can either keep the floaty on to have a little less resistance, or they can take the floaty off for the more resistance. And then the next exercise they'll do is with kickboards. They're going to put the kickboard in between their legs, and so then they would only have to use their arms, and they'll just swim like a normal breaststroke. And then they're going to switch and put the kickboard around their hands, so then they just hold onto it and use all of their leg to strengthen up their legs. And those are some examples of some pull exercises. Today I'm going to be doing PNF stretching. So the first one I'm going to do is hold and relax. So I'm going to passively stretch the patient's hamstrings, bring their leg up, and then I'm going to ask you to push against my hand, and then relax. And then I'm going to try to see if they have any more flexibility, which she does. And then I'm going to bring their leg back down. And then the next one is contract, relax. And so this one, I'm going to passively bring their leg back up, and then push against me. And this is the isotonic. And then I'm going to bring their legs back up and look for more flexibility. And then the next one is slow reversal, hold and relax. So I'm going to ask you to contract your quad and then bring your leg up. And then I'm going to ask you to push against my hand and then relax. And then can you contract your quad and bring it back up again? And you're looking for more flexibility. And that is all of PNF stretching.
Alright, so the first skill that I'm going to be performing today is joint mobilization. This is going to be used to increase range of motion. The joints I'm going to be doing are the ankle, the knee, and the shoulder. So for the ankle, you want to have your patient lying on their back for dorsiflexion, have their foot hanging off the edge. Always you want to assess first, so dorsiflexion, you want to push up, check their other one, and then when you're doing it, you want to stabilize at the distal end of the tibia. You're going to distract the joint, and then you're just going to oscillate for about 30 every second. For plantar flexion, you're going to want to have them lying on their stomach. And once again, you're going to check to see what their range of motion already is. and you're gonna stabilize at the distal end, distract the joint, and then oscillate for 3 seconds, or do 3 oscillations for every second. Now for the knee, you're gonna have them lying on their back. For knee extension, you're gonna have a towel underneath, and you're gonna be performing kind of like a Lockman's test, and you're going to distract the joint and then oscillate here. Let me switch it so the camera can see. You're gonna oscillate. And then for flexion, you're gonna have them in a anterior drawer, posterior drawer position. You're gonna distract the joint and then oscillate. With the shoulder, it's gonna be like the other two. You're gonna want to assess the range of motion first. So you're gonna assess flexion and extension, and then you're gonna want to get them in a relaxed state. So you're gonna grab the arm, stabilize on the AC joint, distract the shoulder, and then oscillate. Now all of these skills are going to be able to increase range of motion at these joints for your patient. Alright, so I'm going to be doing the skills for FRS and ERS of T8 and C7. So for a T8 FRS, say they're having a left FRS, they're going to be in flexion, rotation, and side bend. Now you're going to want to palpate into the vertebral space, and you're going to want to squat down to your patient on the symptomatic side, and they're going to go into right ERS, or they're going to try to, and you're going to resist them. So same and kill. Good. Stop. And then say it was for ERS on the left side, there would be an extension, rotation, and side bend. You would do the same thing. You would palpate into the vertebral space, and then you would squat down to your patient's level. You're gonna get close, and then you're gonna have them go into FRS. Good. Stop. All right. So for C7, say they're having a left FRS. You're gonna want to have them lying on their back. You're gonna cradle their head, and then you're gonna put them into a right ERS. So you're gonna put 3 fingers up on the temple, and they're gonna try and do left FRS. And that's the same thing if they had a left ERS, you're gonna put them in right FRS. And then they're gonna try and go back into left ERS.